So, before we start talking about health system strengthening, it is important for us to briefly discuss at least the COVID 19 pandemic and the emergence of the Omicron variant. So, this shows basically the global deaths for a 2 year time span, um, that being 2021 and also 2020 from the WHO weekly epidemiological update for the week of November 30th, which was basically this past week. And this is based on the WHO world regions. And it shows both deaths and case reports. And as you can see, there has been spikes in both cases and deaths. And in fact, you can see that deaths and cases tend to be cyclic in this pandemic over the past 2 years. So this shows you, number one, we're not out of the pandemic, and there has been and will continue to be unfortunate deaths until this pandemic is over. So here we have basically a depiction of the mutations and deletions for the Omicron variant of COVID-19. The mutations here are indicated in yellow and with deletions here in gray for the spike protein. And this was published in the New York Times last week on November 26th. So here's a top overview of the spike protein. And what worries many scientists is that these particular mutations could make it basically resistant to the current vaccinations that we have for our Delta variant that is widely available. This is unfortunate because, again, there's not a lot known about the Omicron variant in terms of COVID-19, and it could prove to be significantly worse than the Delta variant. Currently, transmission has been confirmed in all of these countries, and I would probably guess that transmission is probably in more countries than what is depicted here. And this is, of course, information based on December 2nd. I think that we have probably transmission in more countries than we know about, and information is emerging that it is rapidly being transmitted. The question is, can it outcompete Delta, and is it actually more deadlier than Delta? And those questions actually remain to be answered. So in the previous slide, I showed that there was transmission in several countries. CNN confirmed, and several news outlets also confirmed that the first confirmed case of Omicron occurred in California on December 1st, and then NPR also confirmed on December 2nd that New York reported its first Omicron case in December 2nd, and actually it was associated with a convention in New York City, and that has led to other transmissions being confirmed in other states also. So there seems to be spread across the United States, at least associated with that event and other events. But again, there are several questions remain in terms of the variant and its transmissibility and whether its lethality in the population. As of December 1st, we basically know that Omicron has been confirmed in 16 countries, and of course the numbers will continue to increase from 16. We know the number of cases that have been confirmed at least, and this, I would say, speaks to at least the health care system of those countries in which they have great surveillance. And I have to say that we have to at least give kudos to South Africa to have a strong surveillance system to detect this particular variant and warn the world. in terms of the Omicron variant. And that, I guess, dovetails into the conversation we're going to have about health, strengthening healthcare systems around the world. Because when you have a strong healthcare system, you can warn countries about these particular variants and be able to at least put into measures uh, specific systems that can stop basically the spread and transmission of these significant viruses. It is also important to note that the Omicron variant is not the only variant of COVID-19 that has emerged. And in fact, there has been several different variants of COVID-19. And if we look at the emergence of COVID-19, we can see that different variants have came into prominence, including Alpha and Epsilon. But of course, the variant we're dealing with now is Delta, which was more competitive and outcompeted both Alpha and Epsilon and has rose to become the most dominant variant. The, uh, the most important question is whether Omicron, given its uh, mutation, will have the ability to outcompete Delta. And we do not have an answer to that as of yet. We're going to have to wait and take a an, a wait and see approach. So, not to downplay the Omicron variant, there are some very concerning things about it. First, there are over 50 mutations, and over 30 of those are at the spike protein. However, there are several things that we don't know. So we don't know if those particular mutations are consequential and will lead to actually anything of consequence in terms of this particular variant. So is it more transmissible than the previous variants? Specifically now, the Delta variant is very dominant. So will Omicron be able to outcompete Delta? We don't know that. Is it more virulent than the previous variants? So, for example, can it cause more mortality or even greater illness? We don't know. Will it compete with Delta variant or even outcompete Delta variant to become the dominant variant? We do not know. Is it resistant to our current vaccines and monoclonal antibodies? Again, we do not know. And will our new antiviral drugs work against Omicron? Again, these are questions that we do not know, and we will, of course, have to wait and do significant laboratory tests to try and figure all these questions out and arrive at scientifically justified answers in terms of Omicron. But again, as I've shown you previously, this is not the first variant of COVID-19 that we have encountered. And as this pandemic continues, what we've seen is that, of course, the COVID-19 virus will continue to evolve. And until we have everybody has taken their vaccinations and we have herd immunity, we're going to get the evolution of these of the COVID-19 viruses, and we're going to have, of course, the emergence of course, mutated strains, and unfortunately, if we are at a point that we still have, of course, not reached herd immunity, we are going to get to one day, unfortunately, have a very virulent strain that can cause significantly more morbidity and mortality that could have been preventable. Welcome to session 14 of Foundation of Global Health. This session, we're going to talk about health system strengthening, define what health system strengthening is, and talk about two frameworks and discuss the importance of health system strengthening. So first, let's discuss what health system strengthening is. Health system strengthening is a term in global health that roughly means to improve the health system of a country. And this can be done at the macro level or at the micro level. So, what is a health system? Well, basically, a health system consists of all the people, institutions, resources, and activities whose primary purpose is to promote, restore, and maintain health. Health system strengthening comprises of strategies, responses, and activities that are designed to sustainably improve countries' health systems. So, of course, health systems contain public health services, personal health services, and health research systems. And this is basically a country's health system. Now, when we talk about health system strengthening, or HSS, there are several frameworks that exist. Um, Two of the most popular frameworks includes the World Health Organization framework, which actually describes health system strengthenings into 6 building blocks. This is at the macro level. In addition, there's also another framework, which is the USAID framework, which focuses on the theory of change. USAID actually is focused on input output impact continuum and is actually focused on the micro level and it usually addresses things based on USAID mission oriented priorities, including maternal and child health. And this is, in my vision or in my viewpoint, aligned at the micro level. So the WHO approach is at the macro level, associated with financing, governance, information, human resources, and is sort of broad country level, whereas USAID is focused on micro levels, reducing child mortality, neonatal deaths, etc. So health system strengthening can occur both at the macro level, based on WHO vision right here, or at the micro level, based on USAID's vision right here. So I'm going to briefly cover these two to compare and contrast the differences. So at the macro level, WHO thinks more about leadership and governance. And that's what basically WHO works. WHO works with country leadership, ministries of health, in terms of thinking about more broader visions, setting agendas for the entire country. They think about sort of these 6 building blocks in the macro level, including leadership and governance, thinking about healthcare financing at the country level, thinking about how you develop the entire healthcare workforce at, again, the macro level, medical products and technologies for the entire country level to meet all of the demands for the entire country level, information systems and research, and then service delivery. Also, in terms of addressing access and coverage, and then quality and safety. The overall goals in terms of the WHO model is to improve quality and level and equity. Again, at the country level, responsiveness in terms of the healthcare system, and then also financial risk and protection, and then improve efficiencies, again, at the entire country level. USAID's vision is built on the WHO's sort of macro level, but USAID also focuses it on the micro level to address specific areas. One of the areas, for example, can include maternal and child health, as stated right here. Of course, with USAID's vision is desired for immediate outcomes of equity, quality, and resource optimization that leads to positive health outcomes, learning and adaptation, and building blocks representative in the 6 core functions of a health system, and cross-cutting approaches that include social and behavioral change, and cross-sectorial linkages that enabling local organizations that are critical elements of activities that lead to high-performing healthcare system. In terms of WHO's model, behavioral change and cross-sectorial linkages, although are sort of implied, those are not necessarily part of it because, again, WHO's model is more on the macro level. In terms of USAID's model, their overall outputs and outcomes are specifically target-oriented in terms of addressing specific needs, in terms of, for example, goals to reduce, for example, HIV infection rates, or specifically to a specific agenda item focused on one of its mission areas. So those are the ways in which they both overlap, yet are different in terms of their focus on building healthcare systems in terms of health system strengthening. Moreover, when we discuss USAID's vision for the micro level, it focuses on better health outcomes in domain areas such as HIV, maternal health, and other disease areas. And it also focuses on equity, quality, and resource optimizations, specifically in those disease areas. On the macro level, with WHO, they do not necessarily focus on those particular outcomes. They do focus on quality and they do focus on better healthcare outcomes in terms of training, but they focus it more on just the governance level. Although USAID also looks at improvement in healthcare system, they also focus on primary healthcare, secondary and tertiary healthcare, and public health functions as a whole in terms of addressing their disease areas. And then finally, of course, both in terms of healthcare structure, USAID aligns it with the Sustainable Development Goals, universal healthcare coverage, and then, of course, because they work with the U.S. government, they also align it with the health security and health system resiliency. And that ties into COVID-19 in terms of health security and health system resiliency. As stated before, health system resiliency and health security are important because if you have a health system that's resilient, it can detect emerging threats and be able to, of course, notify its partners of these particular emerging threats. And then, of course, optimize its system to be able to take on significant challenges of those particular emerging threats. In contrast, the WHO Health System Strengthening Framework does a variety of things, but again, it's focused on the micro level, which identifies and implements changes in policy and practice in a country's healthcare system to better respond to its healthcare and healthcare system challenges. It also aims to improve one or more functions to increase access, coverage, quality, and efficiency, including, for example, medical products and technologies, information and research, and then also service delivery, including providing or thinking about policies or creating policies that improve service delivery, training of all medical staff. For example, USAID's systems might focus specifically on training staff in specific disease areas. Policies will think about training staff holistically and how to improve staff training to strengthen healthcare systems countrywide. Healthcare system strengthening is actually linked to the Sustainable Development Goals, the SDGs, and is actually linked to SDG 3, which is good health and well-being. The SDGs, of course, are emerged from the Millennium Development Goals, which are located here from 1 through 8. And as we know that the Millennium Development Goals were not achieved, so they morphed into the Sustainable Development Goals. One major tenet of health system strengthening is actually universal health coverage, or UHC. So, what is UHC? A lot of health system strengthening jargon is around UHC. Well, in terms of what UHC is basically equity and access to health services to all who need them, and not only to those who can just pay for them. So the concept is basically everybody contributes a little bit so that everybody can have equal access, equality in terms of care. So the quality of services should be good enough to improve the healthcare of those who are receiving them. People should be protected against financial risk, ensuring that the cost of service does not put them at risk of harm. And that is basically the concept of universal healthcare coverage. The WHO or the WHO's approach is health financing is essential medicines and products, health system governance, strengthen the healthcare workforce via healthcare statistics, IT, health service delivery, and of course, safety. And that can usually occur via health system financing, which occurs through universal health coverage at the country level. SDG 3, Good Health and Well-Being, is aimed at achieving universal health care coverage, which includes financial risk protection, access to quality health care services, to safe and effective and affordable medicines, and of course, vaccine for all. Unfortunately, given where we're at with COVID-19, we have not even been able to achieve vaccinations for most of the world in terms of COVID-19. So even though it's a laudable goal, we have not been able to achieve this for COVID-19. So we still have a long way to go. There are several indicators for SDG 3, and those indicators are listed here. WHO keeps monitoring these indicators to see how well we are progressing toward SDG 3. Hopefully, we will eventually achieve much of what is laid out, or the vision for SDG 3. This data from the Global Burden of Disease 2019 study shows effective UHC coverage. And as you can see, there are different levels of coverage depending on which country and world region. You can see that there are significant high amounts of coverage in North America, over 50%. In South America, there's also over 50%. In Sub-Saharan Africa, there's in some countries there's 50% or less, and then of course in parts of Asia, of course, there's less than 50%, and then in other parts of Asia and Europe, there's over 50%. An essential part of actually health system strengthening is human resources, or the workforce. And in fact, this book by the WHO discusses that critical element. So tackling healthcare workforce is very complex, and it's also fraught with significant political issues, and is also associated with social and political action by healthcare workers. So, for example, all countries can accelerate health gains by investing and managing their health workforce more strategically. So this specific picture talks about the healthcare resources and clusters, and it shows low density and low density workforce and high mortality here, and then also high density workforce and low mortality indicated in the gray. And then there are various in between countries. So it shows that there is a correlation between workforce and also health outcomes, which is actually an essential element and is probably one of the most critical elements in terms of improving or strengthening health systems. So, healthcare workers are the glue to healthcare system strengthening. And basically, they spearhead the performance of health systems, both curative and preventative, because it is they that basically undertake the work in terms of informal and community workers, laboratory technicians, and professionals that shape the output and productivity of healthcare systems. It is also these workers and in which they manage and synchronize all of the other health resources, including financing, technology, information, and infrastructure. So their actions are significant, and it is their actions that leads to basically determine whether a healthcare system will function efficiently or non-efficiently. It is also their actions that determines whether um, that major element of efficiency is very important. If they are recalcitrant to learning and uptake of technology, then the health system will not progress. If they are not recalcitrant and are quick to adopt technology and drug utilization and knowledge and information, a health system will move forward, patients will do better, outcomes will improve, and things will, of course, will move in an orderly manner. Again, that will be the outcome. More so, most healthcare systems, it is the human resources that occupy a significant amount of their budget. Because of their budgetary importance, you cannot live without those particular resources. There is no healthcare system on earth that can function without, of course, the human resources, not only in terms of doctors, nurses, and other individuals, pharmacists, but also the support staff that works around them to administer patients. So again, it is the healthcare workers that are the binding constraints for achieving health-related outcomes and are truly the glue and are basically the important factors in terms of healthcare strength. So the question is, why are healthcare workers so important? It's not just healthcare workers, it's also the quantity and the quality of healthcare workers. So based on the data, it seems that an increase in healthcare workers is also associated with a significant decrease in maternal mortality, infant mortality, and under 5 mortality. And this is data that has been shown and was published in 2004. So the analysis suggests that a 10% increase in density of healthcare workers is correlated with a 5% decline in maternal mortality, and a 10% increase in health worker density is correlated with a 2% decline in infant and under 5 mortality. The hypothesis is simply that highly trained medical personnel are more essential for the emergency obstetrical services to avert maternal deaths than for simpler tasks such as immunization or infant and child health. So again, that shows the importance of having not only highly trained healthcare workers, but having enough healthcare workers so that you can have an overall impact to reduce the global numbers or the large numbers of mortality for many of these services at the population level. Basically, healthcare workers are a significant public health intervention. Although healthcare workers are important in terms of addressing mortality, um, we know that there is a maldistribution of healthcare workers, which reflects inequities that exist within the global system. So, based on this graph, you can see that there are some regions that have a significant number of healthcare workers compared to other regions, those regions that have a low abundance of healthcare workers. Those include South and Central America, the Middle East and North America, Asia, and of course Sub Saharan Africa, having a significant amount of healthcare workers. Now, of course, that does not mean that these regions do not train healthcare workers, but of course, these healthcare workers do leave these regions to seek better opportunities in countries within Europe and North America due to better wages, better living conditions, etc. And of course, this has been termed the brain drain, in which there is a migration from Sub Saharan Africa, Asia, the Middle East, South and Central America of highly trained, highly skilled individuals to Europe and North America. So that, of course, exists and exacerbates those issues in terms of healthcare workers. So this is an interesting graph that shows the percent of global burden of disease uh, as opposed to the percent of the global workforce. And it shows that in terms of the distribution of the global burden of disease versus the global workforce, of course, there are maldistributions of the global workforce versus disease burden, and it's unfortunate. And of course, this issue is continues to be a significant problem in terms of the global workforce. Regardless of what country you live in, there are still challenges in terms of the healthcare workforce. For example, in terms of the global workforce, there are shortages around the globe. There are skills and mixed imbalances. Now, whether you live in rich or poor countries, there are still a number of imbalances in terms of skills, geography, in terms of workforce. There are maldistributions and immigration. There are negative work environments. And then there's also weak knowledge base. And all these affect the entire global health and healthcare workforce. And that needs to be addressed. And that cannot be addressed by one sole entity, but it needs to be addressed utilizing a more genuine, multi party, pluralistic model. So, how we can address those issues with the imbalance in terms of the global health workforce is by strengthening the governance frameworks, by harnessing the power of technology that we have at our hands. We can rebalance the healthcare tasks that many people do. We can also develop new care models that exist and also disseminate those models widely. And we can create a sustainable and gender balanced workforce. Those things will, of course, lead us into, of course, improving the global health workforce. In session one, we discussed that health, according to the World Health Organization, is defined as a state of complete physical and mental and social well being, and not merely the absence of disease and infirmity. So, in essence, Understanding the social determinants of health is an essential element. And in fact, this picture represents that in terms of our lives, there are many influences: the individual lifestyle factors, social and community networks, general socioeconomic, cultural, and environmental conditions that contribute to our own well being. Those elements also actually contribute to our overall health, which meets with the WHO definition of what health is. So, in fact, we have to understand that our understanding of health has to be more encompassing than just the absence of disease. To truly appreciate health system strengthening, we must understand this concept, and we must understand that strengthening health systems requires us to not only strengthen those systems, but to understand that ultimately health improvement also requires that we appreciate the nuances within those particular societies outside of the health systems that also contribute deleteriously to impact health. Those physical and mental and social issues that also contribute outside of the healthcare system to impact health in individuals outside of the healthcare system. So, again, relating everything back to our first session one, that the social determinants of health cannot be ignored in terms of healthcare and health system strengthening. And in fact, they are very, very important, and we need to also pay attention to those elements. And last but not least, every healthcare system should focus on prevention. And of course, as this cartoon figure says, I believe in prevention. So, can you give me a pill that will prevent me from having to exercise, eat less, and stop smoking and drinking?